Good morning, everybody. My name's Chad Norris. I'm going to be giving a brief presentation this morning on CBT, or cognitive behavioral therapy. Um, it's become one of the most effective and popular therapies in the world. Um, we're going to look at basic principles today, like who created it, how it works, a typical session, and things of that nature. I appreciate your time and patience with me as we work through these slides. Next slide here is just a brief overview of what we're going to be covering today, introduction, history, how it works, a specific case, my personal thoughts and conclusions uh, on it. I'm a social work student, so cognitive behavioral therapy is important to me. Um, Presenting is a novel experience for me, so please bear with me as I work through these slides and try to explain this type of therapy as best as I can. If you see here, there's a brief timeline visual here on this slide explaining the beginnings of CBT. Uh, it started with two key figures, Albert Ellis and Aaron T. Beck. In the 50s, Ellis had developed his own form of therapy known as rational emotive behavioral therapy. Um, and this basically was on the idea that irrational beliefs equate to unhealthy emotions. And in the 60s, Beck built on Ellis's idea um, uh, and incorporated it in dealing with depression, um, trying to identify people's automatic thoughts. Uh, People have negative thoughts towards themselves, thoughts in the world, and this is called the cognitive triad. And Beck worked to identify these in his patients and try to help them. Ellis and Beck together created CBT as we know it today. You see here, I got a nice little graphic explaining some of the core principles of CBT, and the theoretical foundations are that thoughts, feelings, behaviors, and actions are all connected, and that if we can change our thoughts and behaviors and feel our thoughts and feelings, perhaps we can change our behaviors. Uh, CBT is more focused on present problems instead of a therapy like psychotherapy, which is heavily dependent on the past and things like that. Uh, CBT helps identify patterns of distorted thinking and replace with realistic, goal-oriented types of action. So here we have the major components of CBT, cognitive restructuring, which is changing the way we think, behavioral activation, which is not avoiding our problems, but addressing them head on. Homework is a part of the therapy where the therapist will give the client things to work on in between sessions. Of course, it's a collaborative approach between client and therapist, and they are equals um, in this relationship. Trust and empowerment, very important in the therapeutic relationship here. CBT works best. It works over such a broad uh, population. Many different types of people can benefit from it, from CBT. Most often depression, anxiety, but trauma, phobias, substance use disorder. It works for people of all ethnic backgrounds. Works for people among all age groups. So it's really CBT is a versatile go-to weapon in the treatment of modern mental health issues. Moving on here, we're going to look at a typical CBT session. It begins with agenda setting. and focusing on the automatic thoughts, the tools, learning the tools and the things to deal with these problems, like journaling, and then becoming aware, pardon me, becoming aware of our own inadequacies, as it were. Maybe inadequacies is a poor choice of words, but it's basically pulling those negative thoughts that we may have in our typical daily lives of thought and trying to restructure, reframe, and then tackling them with a new type of behavior instead of the behavior that we've always had. And the therapist is there to guide the client in realizing these types of things. I have a specific case I want to give an example of. This is Grant's case. Um, Pardon me. Uh, this is a real life example. CBT changed this woman's life. In short, her case summary: she experienced self-loathing, panic attacks, and negative things of those nature. I have a quote here. This lady used creative writing, which was encouraged by her therapist to help her treatment. And this lady said, CBT has genuinely given me the tools to fight and overcome any black mood should it try to engulf me again. I think that's a very poignant example of how CBT works. It's an active uh, attack on those negative thoughts and changing them. The strengths of CBT versus the limitations. The strength are it's an evidence-based therapy, so it's been proven to work. It's structured, limited. It's practical. Um, it teaches us tools that we can use after therapy that we can take home with us and apply uh, in our everyday lives. Some of the limitations. Some argue it may lack the depth to treat really deep emotional trauma, and it may need to be combined with other therapies to be fully effective. And also a key proponent to look at here is that the client has to be motivated to change. It makes the process work. Without that willingness, um, no type of therapy is going to be very effective. Moving on. My personal thoughts on CBT, why I enjoy it is it does align with social work ethics. It's aligned with our core values. Um, it doesn't just treat the symptoms of any kind of mental health disorder. It gives us tools, lifelong tools that we can use going forward. Um, I personally struggled with mental health issues, have been involved in some CBT therapy, and have found it very effective. Uh, I've enjoyed being here today discussing a little bit about CBT. Here are the references of the little bit of research I've done for this project. I appreciate your time and your attention for listening to me and hope it wasn't very painful. Thank you.